So I'll give you an example. There was a gentleman who was in a car. He was a passenger, and he was the rear seat passenger of a car. And the car hit into another car. The front seat passengers, both of them, died on the spot. This gentleman at the back was not wearing his seat belt.
Oh, and we have from the in Hello, and other of all what they are here with my cousin daughter Muhit Munje.
My pleasure. Nice to be here with you.
He is in everything made like a boy on what
Thank you.
we are my in him was so people like me and would you be give us a simple of everything many
Emergency medicine is comparatively a newer branch of medicine. It deals with all kinds of emergencies, including accident. So if you had to have a example, a car accident, or you had a fall, or any kind of an injury, could be minor injury, it could be a major injury or life-threatening injury, or you have conditions like heart attacks, strokes, severe breathing problems. So these are few of the examples. So we deal with all these type of emergencies.
can you hear some example of the people in the
So diseases which require immediate attention, it would be conditions like sepsis, meningitis, encephalitis, um, like acute diarrhea and vomiting, where the patient is getting dehydrated. Although we don't see them in the UK that much, we see viral. But in countries like Africa and subcontinent of India, you get outbreaks of cholera. So these are diseases, infectious diseases. You get conditions like COVID, pneumonias. So these all require urgent uh, intervention. Kidney infections, abdominal infections. These are infections, but the list goes on. There's every organ in the body can be infected. Specific conditions, which, if you are asking about conditions rather than diseases, it could be conditions like severe conditions like strokes, heart attacks, severe asthma, severe headaches, These are different types of conditions which require urgent interventions.
Would you provide where we must meet the seriousness of the event?
Yeah. So I'll give you an example. There was a gentleman who was in a car. He was a passenger, and he was the rear seat passenger of a car. And the car hit into another car. The front seat passengers, both of them died on the spot. This gentleman at the back was not wearing his seat belt, and his neck hit the headrest of the front seat. So he basically just had injury to his neck. And he was sitting, when he came to the hospital, he was okay. And by the time I started seeing him, well, actually, he was seen by one of my colleagues who was not trained in airway management. And by the time I started seeing this chap, his throat started swelling from inside. And immediately in 5 minutes, he collapsed. So I had to intubate him. I had to stick a tube into his throat, into his airway, to help with his breathing. Otherwise, he would have died. This is an example. So we underestimate the seriousness of the injury by looking from the outside, because outside there won't be any signs. Another example would be basically person who has been stabbed. So from outside, if it is only a single entry, you do not know what damage it has done inside. The same thing for a bullet injury. So the bullet would have caused a lot of damage inside. So you always underestimate. So you do not know what all damage it is done till you don't do a CT scan or take the patient to the theater and open up and see what all damage it has caused. These are few examples.
How can we um a couple during everything?
So the only thing is not to panic. So the more panic you create, the patient also gets panicked, and the staff around you also get panicked. So in example, when you are in between a cardiac arrest, so you have to do everything according to protocol. There's no point of panicking, because panic then creates a lot of chaos and things go wrong. So if you just stay calm, follow the algorithms, give the medicines every 3 minutes, do the chest compressions. These are examples. So you to just remain calm. The outcomes are favorable.
All, 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 but a doctor. How you get to and how much you get to yourself.
We do get cross infections from patients, especially during COVID. We had to take extra precautions. Uh, by grace of God, I did not have COVID up to now, and I don't intend to get it. I've had my vaccinations. But yeah, if we do get infections, like I remember about 7 8 years ago, I got a chest infection from one of our patients who was coughing, and it took almost 3 months to get better. So yeah, we have to take treatment ourselves also. Fortunately, I work in the hospital, so it's easier for me to get
Yeah,
other doctors to see me.
yeah,
So there's a long process of seeing GPs and then getting referred to the hospital to see a specialist.
yeah. What, what, yeah, and help us to differently between evidence and non-emergency.
Um, so we have something which is called a triage system. So when the patients book into the emergency department, we have a triage nurse and a whole triage department. So there are different specialists over there who actually triage the patients according to the seriousness of the illness. So if the patient had to come in with severe chest pain or severe, say, headache, they get triaged into a category 1, so immediate. So it will flag up as red. So that patient needs immediate treatment or the immediate assessment. So they're moved to a different area of the department to be seen by a doctor straight away, preferably a senior doctor, and they get triaged accordingly. So they have an ECG and blood test or an X-ray, or they got severe headache, they have to have a CT scan, or if they're met with a serious accident, they get the treatment straight away. So the non-emergencies, then they go into different other categories. So they would go into a green or a yellow. Those, we have that something called a Manchester triage. So we triage them according to the emergencies. So if it is coming down to a category 3, they can wait to be seen. As category 4, then would be downgraded to a minor illness, and they would be directed to see a doctor who sits in urgent care.
De donde me in the what in the
So the economic, it all comes down to the economics. So the UK, where I practice medicine, and we have a very good health system. It is called the NHS. The ambulance system, the air ambulance system. So they're very, very effective. Um, so the I think the resources is the most important. The government has basically got plans to have hospitals within the vicinity of every 15 to 30 miles over here. So there are something called DGH, District General Hospitals, and then there are hospitals which are major trauma centers, a level 1 trauma center. So these hospitals basically provide higher end care. So there are surgeons like neurosurgeons, cardiothoracic surgeons. Um, UK is not a very big country, so these things can be done in in smaller countries. Now, if you had to go to like bigger countries, um, you can take an example of, say, Canada. So it's a sparsely populated country. It's not a very densely populated like the UK. So the services are spread out. So getting from point A to point B, sometimes it could take hours. The same for United States. So if the patient is far away from a hospital, they have to wait for air ambulance or helicopter or something to be airlifted. Um, but then the level of care is still extremely good. Now, if you had to basically compare like medical services or emergency services in a country like India, so getting um, into the service is quite difficult because of um, you know the number of patients. It's always to do with the number of patients, because there'll be lots of patients waiting for the emergency care. And as I mentioned, the economic, it comes down to the economic. So In the UK, of course, the NHS is free. In the US, it's all to do with the insurance, and so you get a good level of care. India, poorer countries like, I would say African countries, subcontinent, Southeast Asian countries, uh, some of them. It would all depend on how much money you have. I'm sure it would be the same in Latin America also. If you don't have, the money, then you don't get that sort of level of care. It all comes down to, I think, logistics and economics.
in evidence scenario was the you measure is following the and was guru.
It's usually staffing. Um, one is in, if it is life threatening, always we do manage to make space for to see the patient. Um, I'm talking specifically about the UK. We have, um, at the moment, the hospitals are over capacity, so it's very difficult to find place to see the patients. Um, but we do find place. Then the resources basically is to get the nurses to come to do the blood tests, the ECGs, all the relevant, and provide all the relevant medications. Then move the patient to, you know imaging like CT scans or X-rays, and then obviously getting the specialist streams involved. So if there is like a bone fracture, then you need to get the bone specialist down to take the patient to theater to fix it. For example, if the patient has had an appendicitis, to get the surgeon to come and fix it. These are examples. So it's basically using the resources appropriately.
How is we improve health from economic the in
Um, for economically disadvantaged individuals. So I think, um, most governments, I think, around the world are trying to improve their healthcare systems. The WHO themselves are also trying very hard to provide this. Specifically coming down to people who have, um, if you're talking about like disabilities, or, um, in the UK and in the first world countries, these patients are always prioritized. Um, People with learning disabilities, or patients with, physically having handicap, so they do get priorities compared to other patients. um, Again, it all depends in other countries about, the economics, and again logistics. So getting the patient into the hospital is also another challenge.
do have experience from always
um, Minor operations on my own, yes, lots of them. Major operations, no, only as a junior doctor when I was assisting them, when I was in training. I do not perform them on my own. Minor procedures I still do on my own, yes.
what written advisement have us in the field of emergency medicine?
The recent advancements. Um, See, if you compare it with 20 years ago, um, having an ultrasound department in the emergency department was unheard of. Having X-rays in the emergency department was unheard. You had to go specifically to radiology department. Now most of the emergency departments have got X-rays in there, and you have ultrasound. And most of the senior doctors in the emergency department are being trained to use ultrasound so that you can do a bedside ultrasound and diagnose. So these are new advancements. Airway management, like anesthesia, basic anesthesia training is being provided to all the emergency doctors. So these are new advances. These things were not there many years ago. Providing some life-threatening surgeries, like a thoracotomy, if the patient has had a bullet straight going into the heart, doesn't have time to go to the theater, so we have to open their chest right there. So these are recent advances. Yes. Mm-hmm.
How, how, how has the medical field?
So the artificial intelligence has just basically started impacting. So if you take an example, um, if a patient has had to come in with a stroke, and say it is in the night, the radiologist is not there on site to report the scan. So patient goes to have a head scan, a CT scan, and artificial intelligence can report the scan straight away and tell you, is there infarct, a stroke, or a bleeding in the brain. So these are some new advances. Robotic surgery is just making its way. So there are a few examples are there. It's coming. It's going to be here.
Can you hear your on for this on many people?
So my thoughts for potential AI is, um, I believe Google is already working on one of these, where you basically sit in front of the computer, talk to the computer. It takes a list of your symptoms. You say, oh, I've got a fever. It'll ask you, do you have a headache? Do you have a sore throat? Do you have a cough? Do you have a cold? So so the computer starts basically the process. And I believe, me personally, in the future, possibly there will be a probe on the computer where you can basically put like your thumb, and it will read your heart rate, or maybe it finds your blood pressure, temperature, all those things. And and possibly in the future you may have to have an imaging, and you can go through an X-ray. The X-ray will be reported by the artificial intelligence and tell you, okay, proceed to collecting some antibiotics, you have a chest infection or whatever. I'm giving you an example. So this is possibly coming. It's not too far in the future. I think it's going to be there very soon.
What your vision for the future of medical science?
I think the future of medical science is going to be taken over by AI. I was mentioning, I said imaging. A lot of the CT scans, MRIs, X-rays, these will all be reported by the computers. So you'll not require to wait very long. So after you've had the procedure, after 2 minutes, the computer will generate a report. It has to be possibly authorized by a radiologist, by a doctor, before being released to the patient. Um, so I think AI will be playing a very big part, and we rely very heavily on radiology to make diagnosis, because we practice something called evidence-based medicine in the West. So you have to be very sure of what you're treating before treating it. So people want to know, so do I have this or do I not have this? The only way to say yes, you have, and say, for example, appendicitis, is to have the CT scan. And once you have it, yes, then you can go and have the surgery done. But if you've come in with abdominal pain, um, the surgeons in the past used to make a clinical diagnosis, take you to the operating theater and open you up and take out your appendix, and then they say, "Oh, I'm sorry, it was normal." So I think this will be
Yeah.
playing a big part in the future. AI will be playing a big part in the future. Yes.
Yeah. How, how about you? We I have it.
Excellent. Very nice. Very clear. It was amazing. Congratulations.
Thank you so much more for the informative interview.
It was my pleasure. Nice meeting you, Anand.
Yeah.
Thank you, Amit.
um, Bye.
Congratulations and good luck.
Bye
Bye.
for